So good morning, everyone. My name is Manjeet, and welcome to my presentation, Exploring Physical Activity Organizations in Canada and Alberta, Unveiling Opportunities for Health Promotion Partnerships. I would like to start this presentation by doing a land acknowledgement. My practicum was completed in Edmonton on Treaty 6 territory, as well as the historical regional homeland of the Métis, which includes the North Saskatchewan River Territory, the Lesser Slave Lake Territory, and the Lower Athabasca Territory. I would like to acknowledge and respect the histories, languages, and diverse cultures of the First Nations, Métis, and Inuit, and I'm grateful for the contributions that continue to enrich our communities. My project was completed with the Physical Activity and Sun Safety Team, otherwise known as the PASS Team under Alberta Health Services, or AHS. Their goals are to support hard-to-reach Albertans of all ages to move more and sit less. Their objectives include increasing physical activity by providing the public with information on key messages and to increase the access to the choices and options that promote physical activity for sedentary adults. My project for the PASS team was centered on examining the landscape of physical activity, encompassing a comprehensive environmental scan aimed at identifying existing physical activity organizations both nationwide and specifically in Alberta for potential health promoter partnerships with AHS. Using structured methods, I compiled a detailed list of organizations, their activities, affiliations, and collaborations. From this data, I made recommendations for partnerships and outlined actionable steps for promoting physical activity and overcoming barriers. This approach ensured alignment with public health goals and empirical data. Understanding the benefits of physical activity preceded this analysis. Regular physical activity offers numerous health benefits, from preventing non-communicable diseases like heart disease and cancer to maintaining a healthy body weight and enhancing mental well-being. Engaging in activities within natural settings also aids in reducing our environmental footprint, such as walking or bicycling to reduce carbon emissions. Moreover, increased physical activity contributes to economic growth, lower healthcare costs, and neighborhood revitalization. Despite these benefits, low levels of engagement persist. To address this, we must prioritize initiatives promoting physical activity, raise awareness, remove barriers, and provide support for active lifestyles. Emphasizing the importance of physical activity within health promotion can lead to healthier communities and improved outcomes for all. The social determinants of health significantly influence adults' ability to maintain physical activity levels and can act as potential barriers to physical activity engagement. These determinants, including gender disparities, income and social status, education, employment, the physical environment, and racism, do not operate in isolation. Rather, they intersect, complicating individuals' efforts to engage in physical activity. Consider, for example, the experiences of women, particularly those from minority backgrounds, who encounter both sexism and racial discrimination, compounding the challenges they face in staying active. Similarly, individuals with lower socioeconomic status contend with safety concerns and inadequate infrastructure, exacerbating their difficulties in accessing opportunities for physical activity, with disparities further influenced by factors such as race and geographical location. Moreover, educational attainment and employment status are significant factors, as higher levels of education and full-time employment tend to correlate with increased physical activity. However, for individuals belonging to marginalized groups, these barriers are often magnified. The availability of green spaces and safe urban environments is essential for facilitating physical activity. Unfortunately, these resources are not uniformly distributed across communities, leading to disparities in access and engagement in physical activity. Because of the widespread problem of physical inactivity and its associated risks and barriers, I was tasked with conducting an environmental scan. To accomplish this, I utilized Alberta Health Services' approach to planning, implementation, and evaluation environmental scan guide, following 6 key steps. These steps included defining the purpose of the scan, identifying key stakeholders, establishing objectives and methods, collecting data, analyzing the findings, and disseminating the results. As mentioned earlier, the goal of this project was to identify and comprehend current reputable physical activity organizations serving adults aged 18 to 64 in Canada and Alberta to inform AHS of potential health promotion partnerships. The key stakeholders identified for this project included AHS, the Government of Alberta and Canada, local and national physical activity organizations, community and cultural leaders, and adult Albertans. While stakeholder engagement did not occur during this project due to time constraints, it will be vital for shaping the design and implementation of the recommendations provided. The objective was to spotlight physical activity organizations in Canada and Alberta, informing key recommendations for potential health promotion partnerships. Additionally, the scan sought to identify gaps in resources available to Albertans, contributing to low levels of physical activity engagement and increased sedentary behaviors. Methods involved identifying necessary information, data sources, and appropriate collection methods. Clear inclusion and exclusion criteria were established beforehand to maintain consistency, efficiency, and transparency. Inclusion criteria required organizations to align with the Canadian 24-hour movement guidelines for physical activity for adults, provide targeted information for adults aged 18 to 64, offer evidence-based references within the last 5 years, and operate as government or nonprofit entities. Exclusion criteria included organizations not adhering to the guidelines, those not operating nationwide or in Alberta, for-profit entities, and organizations primarily intended for work or school use. For this environmental scan, qualitative data was gathered from various secondary sources, including online reports, government organizations, credible research entities, and input from past team members and AHS supports. 22 physical activity organizations were found during the environmental scan. However, only 6 met every single inclusion criteria. 2 of these were nationwide organizations and 4 were solely based in Alberta. Despite identifying several organizations in the environmental scan, there are still notable gaps and limitations in what these organizations can offer. For instance, there are persisting limitations in in-person engagement opportunities which impact participation rates. Additionally, few organizations actively address barriers to physical activity, thus contributing to health inequities. And while some organizations focus on specific populations, many lack information on their effectiveness in addressing physical inactivity. Understanding the effectiveness of these initiatives is crucial for determining their impact on meeting physical activity guidelines. After analyzing the collected data, several organizations emerged as promising collaborators. For nationwide organizations, both Participation and the Canadian Society for Exercise Physiology stand out as beneficial partners. These organizations integrate and adhere to the Canadian 24-hour movement guidelines, which are also endorsed by AHS as the recommended standard for physical activity amongst Albertans. Furthermore, their initiatives are based on evidence-based research demonstrating their effectiveness in promoting physical activity. Additionally, both organizations met all of the inclusion criteria outlined for the environmental scan. For Alberta-based physical activity organizations, Communities Choose Well, Alberta TrailNet, and the Alberta Recreation and Parks Association emerge as potential collaborators for AHS. These organizations are recommended because they also adhere to the Canadian 24-hour movement guidelines and are actively developing initiatives with the common goal of increasing physical activity in communities and engaging stakeholders to advance their health promotion initiatives. Collaborating with these organizations would benefit AHS by expanding its reach and effectiveness in engaging diverse populations. In addition, recommendations for actionable next steps included the development of targeted approaches. Addressing barriers to physical activity requires tailored resources and services for underserved and racialized populations. Strategies include tailoring activities, cultural adaptation, utilizing new technologies, and adopting community-based approaches. Involving community members in planning and execution aligns with initiatives with the community's beliefs and values, thereby enhancing receptivity to health promotion efforts. Another step is policy development. Collaborating with stakeholders such as government officials, policymakers, advocacy groups, and community leaders is crucial for developing policies related to physical activity at national and provincial levels. These policies have the potential to impact broad communities and are more sustainable over time. This includes infrastructure changes, regulation of physical education, and funding for campaigns, all aimed at improving access to physical activity. Additionally, policies in the healthcare sector, such as counseling, play a significant role in facilitating physical activity, and policies emphasizing the evaluation of current physical activity organizations is crucial for assessing their effectiveness and reducing inactivity. Furthermore, looking into initiatives from other health regions could greatly benefit AHS. For instance, British Columbia's HealthLink service offers personalized guidance and support for physical activity. BC's health authorities work alongside the BC Physical Activity for Health Collaborative, utilizing various sector partnerships and social media platforms to enhance physical activity endeavors for residents. The data gathered during this project and the recommendations made have significant implications for public health. Collaborating with recommended organizations, AHS aims to boost resources and opportunities for physical activity, potentially elevating activity levels amongst Albertans and reducing non-communicable diseases. This background research reveals the capacity to address disparities in physical activity, ensuring those with limited resources receive tailored support. By advocating for policy changes and drawing inspiration from successful programs like BC's HealthLink service, physical activity efforts can be tailored across all demographics, making resources more accessible. These efforts will help individuals overcome perceived barriers, ultimately reducing physical inactivity rates and positively impacting public health overall. I would like to end this presentation with thank you to Jennifer Painter, our past team manager, Melanie Vance, past team health promotion facilitator, and Dr. Victoria Barr. Thank you.